Dear students, welcome to this session of pharmacology. In this session, we will continue our topic, that is antihistamines. In the last session, we studied about their classification and pharmacological actions. Now today, we will study about their absorption and excretion of antihistamines, their adverse reactions, their therapeutic uses, and a bit detail about second generation antihistamines. So let us start with the absorption of antihistamines. Absorption of antihistamines. It has been observed that antihistamines are well absorbed on oral administration, oral and parenteral administration. So the route chosen for administration should be either oral or parenteral. So now coming to the distribution of antihistamines. These are distributed in various body parts, like we have lungs. It has been observed that maximum concentration of antihistamines is present in the lungs. Besides lungs, they also get distributed in our body in the organs like spleen, kidney, liver, and brain. So maximum concentration is found in lungs. Besides lungs, they are also present in spleen, kidney, liver, and brain. These are metabolized through liver. So metabolism takes place in the liver and are found in different body parts. Now this was about the absorption of the antihistamines. Now coming to the adverse reactions of antihistamines. Now coming to the adverse reactions. So antihistamines show number of adverse reactions. The adverse reactions observed with antihistamines are gastrointestinal disturbances. In gastrointestinal disturbances, patient suffers from nausea, anorexia, and epigastric pain. So nausea is the sensation of vomiting, anorexia is the lack of appetite, and epigastric pain is the pain in the stomach. Now next adverse reaction has been observed on cardiovascular system. In cardiovascular system, they produce the effects like, in cardiovascular system, serious adverse reactions. They produce the effects like hypotension, and palpitation. Next adverse effects has been observed that these cause sedation and drowsiness. Next is sedation and drowsiness. Besides this, they also cause dryness of mouth, nose, and eyes. These are the common adverse reactions of the antihistamines. Now coming to their therapeutic uses. Therapeutic uses. These are antihistamines are used for the symptomatic relief of allergic reactions like urticaria. Urticaria, rhinitis. Urticaria, rhinitis and hay fever. These are used for the symptomatic relief in allergic reactions like urticaria, rhinitis and hay fever. Urticaria is the rashes on the skin. Next, these are used also for the treatment of the these are also used for the prevention of allergic reactions in case of blood transfusion. Blood transfusion. There's a possibility of allergic reactions in case of blood transfusion. So in that case, we also use antihistamines. Besides this, they are also used in the management of vomiting during motion sickness. In motion sickness. Drugs like promethazine is used in the treatment of motion sickness. They are also used in case of cold cures. Cold cures where there is an excessive secretion of nasal secretion. So these antihistamines are used to treat the symptomatic relief for common cold. Now coming to this was about the therapeutic uses of antihistamines. Now coming to the second generation drugs. Second generation antihistamines. Second generation antihistamines are newer drugs than the first generation antihistamines. These second generation antihistamines do possess an advantageous properties over the first generation drugs. The advantageous properties of the second generation drugs include like they are highly selective for H1 receptors and they do not possess any anticholinergic effects. Anticholinergic effects. The anticholinergic effects which are present with the as first generation drugs are here absent. Next, they do not cause depressant effect, that is no CNS depressant effects. So, second generation antihistamines are more advantageous than the first generation antihistamines. Now, we will study a bit detail about the second generation antihistamines. Second generation drugs include number first, terfenadine. Terfenadine is one of the drug among the second generation drugs. So it has a rapid onset of action. Rapid onset of action. It has been observed that terfenadine shows rapid onset of action and remains its effect for 12 to 24 hours. 12 to 24 hours. And this drug is also used for the allergic reactions. Now, next drug in this second generation antihistamines are acetamazole. Acetamazole. Acetamazole is similar to the terfenadine and its onset of action is bit slow than terfenadine and it is used for Perineal rhinitis. What is perineal rhinitis? Perineal rhinitis is the condition in which the patient suffers nasal congestion and running nose throughout the year. So, acetaminophen is used in case of perineal rhinitis. Next common drug in the second generation drug antihistamines is cetirizine. Cetirizine. It is a metabolite of hydroxyzine. It's a metabolite of hydroxyzine and it does not produce the CNS effects, like it doesn't cause any sedation. Next, it is also used in the upper respiratory allergies. So, this was about the antihistamines. For further details, we will continue in the next session. Thank you.